The 1948 Universal Declaration of Human Rights stated that healthcare is a fundamental right. The right to health was recognized as human rights in 1966 at the International Covenant on Economic, Social and Cultural Rights. In Nigeria and Sub-Saharan Africa, many communities still struggle with access to basic medical services. This is one of the major challenges that medical experts say causes high rates of mortality. In response to this trial, non-governmental organizations like Irisville Chapel are stepping up to bridge the gap, providing life-saving healthcare services free of charge. On Thursday, October 17, 2024, over 200 residents of Ilupeju Industrial Estate and its environs on the Lagos West Senatorial District benefited from the 4th edition of Irisville Chapel's free medical outreach, a community-driven initiative aimed at offering vital healthcare services to the general public.
The whole idea is, how do we demonstrate that love for each other? How do we support the less privileged? How do we support health? We know is wealth. Some of us are privileged. We're able to have annual medical checkup, and we know the importance of that annual checkup. That's when you know whether your sugar level is up, you know whether you have diabetics, you know whether you are going to have hypertension. If you don't know, in some cases, you can even predict that in 5-10 years, if you don't take the adequate measures today, you will have hypertension in 5-10 years time. So you take action today. And there are a lot of things we don't know about each other. So in order to be healthy, you study health. And this is part of what we're doing, to say, how can we support those who do not have the means, are not able to have this annual regular checkup, and provide that avenue for them. So we've been doing it. This is our 4th year. Every year we want to make it bigger. We want to invite other partners. We want to make it as big as possible. It's not about Irisville Chapel. It's about the people.
From blood pressure checks to eye screening, cholesterol tests, and free medications, the aim of the outreach is to address critical healthcare needs that are often inaccessible to many due to financial constraints, thereby complementing government's efforts as well as the World Health Organization.
What we are doing here today, we are doing the BMI. They will know whether they are overweight or not. We are doing blood glucose tests. We are doing blood pressure monitor. We are also doing cholesterol so that they know their cholesterol level. We also have the neuropathy test so that they know, whether they are having issues with their nerves. We do the eye test. We are also doing mammogram here today for the women. And then the PSA, that's the prostate specific antigen test to check if the PSA level is high. What we do is they will check whether it's high, whether they are positive or negative. If they are positive, then we refer them to the hospital to get their figures so that they can get treated. So we are doing all these tests free of charge because we want to reach as many people as possible and want them to know their health status. Because when you know your health status, they say prevention is better than cure. And you know your health status, you can then start treatment early enough or prevent it. Like for those who may be doing HIV or hepatitis tests today, they will know whether they are positive or negative. And then when they are negative, they will be told how to stay negative so that they don't, and how to, make sure they are not infected. And if they are positive, they also be counseled on how to not to infect other people and maybe go to the hospital to get treated. So that's what we are doing. We are giving free medications also. We have the drugs here that we give to them, free of charge. We all know what the cost of drugs are in the market, medications now. So we are giving them free drugs also to assist them. Some of them who have malaria get their anti-malarials here today. Those who have maybe raised BP, we'll try to give them something, maybe for 3 days, so that before they go to the hospital to get, to see the physician and continue their treatment there.
It's tremendous. Even despite the rain, people want to take care of our health. But unfortunately, they can't afford going to hospitals. And the public hospital, you could probably go there, do one test, and even the one test, they take you a whole day. But we have 13 tests now. If you want to do all the 13 tests, it's free, including eyes. We don't have government partnership, but we do have companies like AXA, Manstart, who partner with us, who sponsor the BMIs, and they too, of course, will showcase their services to them. When you say health and insurance, they go together. But we are always seeking for more sponsorship, but it's usually self-funded.
Babalala da Silva, a middle-aged man who has been battling with his sight for a couple of years now.
I could even read because I've forgotten I can read.
For many like him, events like this are a lifeline, ensuring that crucial medical conditions are identified and treated before they become life-threatening.
It's very good because it's not my first time, because last year they did something like this and I enjoyed it. The way they attended to us, it was perfect. But for now, I think I went for my eye issues and they gave me this. And this is perfect for me because I can now read very well with this. Yes, I've tried it on. It's wonderful. So I can now see clearly. This is BIM, blood glucose, malaria test, cholesterol, unlike before. They are doing wonderful things, I'm telling you. Getting this now, because I've been to many hospitals, I don't know how much this will cost, but it cost me everything. So Irisville Chapel should continue doing this. I pray for them. God will be with them and give them the strength to continue doing this for us, because it is every year now.
I would just say they should check up on themselves very well, and then they should go to hospitals. Even if not hospitals, they can register under HMO, because most of them that their BP is high or low, if you ask them why are you not taking your drugs, they will actually say they are aware, but they don't have money to buy drugs. So I advise most of them to register under HMO so that they can have access to free drugs within a year, or depending on the plan they choose.
So far, we've been able to detect some people that had cataracts. I didn't even know that they had cataracts in it. And people that have refractive errors, where we have free reading glasses that we give them to help manage and help aid them to be able to read. And people that they actually have distance myopic issues. They can't see things at far. And they didn't even know that you could actually see better than how they were currently. So we're able to see a lot of cases. Those with minor issues we sorted out, and so far it's been good. No matter whatever sign, or you have to get it checked. You have to let the particular medical practitioner see you and get a relevant test done before they diagnose you and prescribe drugs for you. You don't just take decisions on your own. And so in general, we just have to be concerned about our health. We shouldn't just leave ourselves and feel okay, let's wait, let's be managing. No, we shouldn't do that. We shouldn't say this person did this, Mama Nkechi did that, so it will work for me. No.
Somebody uses a needle, you too, you go and use that needle. It's transmitted through that. It's transmitted through, even kissing from the saliva. Sometimes when the person the HIV load is high, it can be transmitted through the saliva. But when you are negative, you know how to now make sure you don't do all those things. You keep, for the women and the men, you keep your legs together, and you stay with one partner. Don't jump from one partner to the other, because from jumping to one partner you can contact HIV. Also.
In addition to the tests and treatments, residents receive valuable health education, empowering them with the knowledge to make informed decisions about their health.
My advice for Nigerians is, think well. Most of the ill health we have is because of, negative thoughts, lovelessness. So my prayer and wish for Nigerians is let us just be happy, joy and happiness. Yes, sometimes we'll be down, sometimes we'll have ill health, but majorly, have good thoughts. Love your neighbor as yourself, and just be nice and happy. You'll find out that you drive disease far away from you if you practice all this. And when you have ill health, of course, you have to go and take care of yourself. You won't just be foolish and say you pray alone. Faith without works is dead. My prayer is that the government of the day, takes healthcare very seriously, subsidizes it and makes it accessible to the people. When you go to the general hospital, for example, they say it's free, but at every table you are paying. And the stress people have to go through, because a few months ago I was there with one of my aunts. She eventually passed on there, and we know what we went through. So my prayer is that, even the doctors, even the health workers, show love and care for people. We need to care for one another. And the government provides all that is needed at reasonable, affordable prices for the people, that they can afford it, and give such opportunities such as this, to throw these free medical treatments out, medical checks out for people, and give them drugs to take care of their primary ailments.
Generally, from the malaria, I noticed that most people are negative, maybe due to what is happening in the economy right now. A lot of people probably they are not eating, and a lot of people have been trying to, a lot of things, I don't know what might actually cause it, but they have a lot of negative. From the hundreds I've screened so far, I only got a positive malaria person, which was an Hausa man, and a lot of people testified that probably he might come up with malaria because he sleeps where he sleeps, And the neuropathy, a lot of people, the elderly ones have, mild and severe neuropathy. It is expected that they will come out with mild, because as you age, these are symptoms of elderly people. The leg, we have to check the feet, the arm, and the numbness of the finger and all that. So so far it's okay. It's okay. People should always check up on themselves. They should check their health. It's very important. Not necessarily they don't have to wait till a year when we have screening. They should always check themselves regularly, because a lot of things are happening right now considering the economic hardship.
Irisville Chapel's free medical outreach is part of a large mission, one that seeks to uphold the principle championed by the World Health Organization, Healthcare for All.
Ìtànṣe níbí báyìí ó wà òkè gan torí wọn kì í ṣẹ̀ṣẹ̀ ń ṣe fún wa ó wà òkè so that pé tó tún fi ní ó tún yálé ní àwọn tí wọn kì í wá tẹ́lẹ̀ a sọ fún wọn pé ẹ̀wọ̀ ìwáṣàyẹ̀wò ara yín wọn gbẹ́ nìtì lọ́wọ́ anybody.
It's very necessary for anybody to cross-check at any time so that I can know whether there's anything, particularly the aged people. You see, the service is quite good. I think the organizers are very good, and my advice to them is to keeping on so that more people will benefit from their service.
Nǹkan tó ń ṣe ó wà ó dáa, so ó tún máa help some people láti mọ condition health wọn so that wọ́n á lè mọ nǹkan tó fẹ́ ṣe so that ẹlòmíràn máa kúkú àìmọ̀dí so kọ́ ọmọ ṣàánú wa so tó máa ń ṣe báyìí lóòrèkóòrè ó máa ran àwọn aráàlú lọ́wọ́.
As the day comes to an end, the impact of Irisville Chapel's outreach is clear by providing critical healthcare services to the deserved. This act is not only improving lives, but also giving hope to the entire community.
Everything I see here is like the best. The same thing you get in hospitals, in good hospitals that you pay great money for. It's being done for free. So I think they should keep it up and, if possible, do it more often. It's been a long time. So it's really exciting for me to be here to do this test now, because some of these things you don't get to see them except maybe you're feeling ill or something, you go to the hospital. So this, I can't remember. Some of the tests I've not even done them before. So I'm just going to do them for the first time here. I got my breast tested today and I saw some things that I've not seen. I didn't know they were in my breast. So I'm learning new things anyway. So I'll keep learning. Thank you for this great outreach, and I pray that God will continue to uplift them and bless them and encourage them to do more.
I even achieved some. I achieved what I know. All the tests I passed, that I test, I really achieved some. Because my BP now, I didn't even have, since the long that I've been doing BP, I do. So once I come today, I noticed that my BP was rise. So that's when I noticed. But it's been long that I do BP and my blood sugar level. So that's why I appreciate what they do for the people. No, I really appreciate that. The doctor really explains some of those things to me. He even give me drugs that this is what I'll be using, and the Vaseline about what they saw on the results. So I really appreciate what they also talk about that also.
The service is good. They are really trying, because this kind of things, it doesn't come on in Nigeria now. So for them to organize this program like this, they are really doing good. People really benefit from it. I say a very big thanks for every one of them. God will continue to bless them in the mighty name of Jesus.
Irisville Chapel's free medical outreach has become a crucial health support event for many residents in Lagos State.
What we are doing here, which we have been doing in the past, is just nothing but service to humanity, service to mankind, for others to emulate in whatever shape or form, to serve mankind, to serve humanity. Irisville is not a rich organization. We're not that buoyant, but the essence of Master Jesus' teaching is sacrifice. So that is what we are practicing. That is what we are demonstrating in this hall.
I cannot underestimate, or I cannot, the importance of annual checkup. Yeah, I cannot, just as I will not underestimate people asking people to make necessary savings in their pension funds to avoid old age poverty. If you don't make adequate provision, it might be too late when you get old to address that issue. There was a time when we could rely on children. You invest in your children and you believe your children are going to look after you. Today, you still have to look after those children. So it's important that we think about our old age and start saving so that we don't have that old age poverty. The same thing with health. As I say, health is wealth. It's important that if you have access and you're able to do this, you should go for an annual medical checkup. As you go older, maybe twice. But you can avoid so many problems. And most of the diagnoses we have are not correct in most cases. It's better to address issues now than when they become a problem. And when you do that, and part of that well-being involves exercise, taking your exercise seriously, involves diet, what you eat and all that. If we can help each other, educate each other, we know that government cannot cannot solve everyone's problem. Government cannot pay for your annual medical checkup. Government has tried a bit to introduce the HMOs and all that. But there are individuals, there are institutions, there are societies that can supplement the action of government. At the end of the day, you and I are one. We're from the same source. If we believe in God, God is our Father. You're my brother. And I said, our job is to love our neighbor as ourselves and God above all. And the way you demonstrate it, this is one of the ways you demonstrate that love of your fellow human being and God above all. I think health is important and critical.
Indeed, programs like these go a long way in supporting the WHO's call for universal health coverage, and Irisville Chapel is doing its part to ensure that everyone has the opportunity to live a healthy life.